There are two articular surfaces on the distal humerus. On the medial side here, we have the trochlea, which will articulate with the trochlear notch of the ulna. On the lateral side here, we have the capitulum, and that's going to articulate with the head of the radius. These two structures collectively make up the condyle of the humerus. Just superior to the trochlea, we have the coronoid fossa, and just superior to the capitulum, we have the radial fossa. Over here on the posterior side of the distal humerus, we have the olecranon fossa, which will articulate with the olecranon of the ulna. The proximal radius consists of a cylindrical head, a short neck, and then the radial tuberosity, which is the insertion point for the biceps brachii. Over here on the ulna, on the posterior side, we have the olecranon and the coronoid process on the anterior side. The walls of these two structures make up the trochlear notch. Just inferior to the coronoid process, we have the radial notch, and that serves as the articulation point for the head of the radius. And just inferior to that, we have the tuberosity of the ulna. The elbow is a hinged synovial joint, so the trochlea of the humerus articulates with the trochlear notch of the ulna. The capitulum of the humerus articulates with the concave head of the radius. You also see an articulation here between the radius and the ulna here in the radial notch. Movements of the joint include flexion and extension. The long axis fully extended makes an angle of about 170 degrees with the long axis of the humerus, and this is sometimes more pronounced in women than in men. Next, we're going to move on to the supportive ligaments of the joint. So the first one we're going to see is the annular ligament, and we can see that here. And this encircles the head of the radius in the radial notch of the ulna. We also have the collateral ligaments on the medial and the lateral side. And these basically are strong triangular bands and that are thickenings of the fibrous layer of the joint capsule. The first muscle that creates movement about the elbow joint is the biceps brachii muscle. It is innervated by the musculocutaneous nerves, and it flexes and supinates the forearm and flexes the arm. Next, we have the brachialis, and that is innervated by the musculocutaneous nerve, and it flexes the forearm. And lastly, we have the triceps brachii. It is innervated by the radial nerve, and it extends the forearm and the arm.